Hello, everyone, and welcome. We'll get started in just a minute. We want to give everyone a chance to get logged on. I don't know where our sound is. We had some cute music going there for a minute, but so with that said, I think I might stop the share. So we can, there's no point in having you sit in silence. Nothing like technical difficulties for a person who is technologically challenged. Welcome to our wonderful, wonderful workshop. We are now, now it decides to have sound. Welcome. I invite you to share where you are joining us from, your name if possible, or if it's other than what your profile is. And then just for giggles, what brought you here? Why did you decide to take this workshop this evening? And we'll get started in just a second. All right. Well, thank you. And welcome again. We are so excited for this, our fourth workshop today in the Safer Births Now series. We are creating a space where we not only speak truth to what's happening in the maternal health space, but our goal is to offer you tools and knowledge to help us move forward. Tonight's workshop centers on what happens after birth. In the next 60 minutes, we're going to cover some common occurrences or complications that might happen. We're going to talk about critical warning signs to look out for. We'll also provide some tools and techniques for you to advocate for yourself if you are the mama or for someone you love. We're excited to see the number of dads who have signed up for this workshop because we know that the partner is a critical component of mama's health. And then lastly, we'll talk about some resources that you can turn to for support. But before I go any further, I am so our group is so humbled and so grateful to partner with the Chi Eta Phi Sorority Incorporated. I'd love to ask Judi to introduce herself. You all have seen her bio on the screen, but I often say that a piece of paper, our words on paper don't necessarily convey the passion and the brilliance of people that the person behind that page. And so each of our panelists will introduce themselves as they come to their part of the agenda, if you will, so that they can lend that personal aspect. But then I'll also ask Judi to tell a little bit about the Chi Eta Phi sorority, and then I believe there's someone that we want to also have a conversation. Judi.
Thank you. I appreciate it, Marie. Welcome, everyone. I hope everyone is having a wonderful evening. Like Marie said, my name is Judi. I have been a nurse for now over 40 years, primarily in maternal health. I absolutely have loved it from day one. And I am excited to be here with my colleagues from the Maternal Health Committee to talk to you all today. But for those of you all that have not heard of Chi Eta Phi Sorority Incorporated, let me tell you. So we are a professional nursing organization that was first founded back in 1932. We are across the nation, and in the U.S. Virgin Islands. We are comprised of men and women who are registered nurses, but we also have chapters of undergraduates, which are our nursing students. And so 12 courageous nurses back in 1932 established this organization. They have left a legacy for us to follow. Our motto is service for humanity. So we do a lot of health promotion, education about disease prevention. For our nursing students, we offer scholarships. We also do mentorship, and we're also sometimes mentees because we never stop learning, and leadership development. And so if you have never heard of Chi Eta Phi, if you are a nurse or you know somebody who is a nurse or maybe even a nursing student, please have them check us out. Our website is chietaphisorority.org. I don't know, Marie, if you're able to put that in the chat for us. Look
I'm
us
on it.
up. And our national president is Dr. Sarah Killian, and she was not able to join us tonight. She had a prior engagement, but I believe that our first vice president, Deborah Stamps, Dr. Deborah Stamps is on. So are you able to bring greetings, Deborah? I'm trying to see if you are on.
See her yet?
No?
We don't see her yet. No, she's on yet.
I see it says she is logging in. So
Okay.
as soon as she gets logged in, then we will for sure have her say a couple of words. So we will just go ahead and get started. So I know that you all either know somebody who has maybe given birth, you yourself have given birth, but I think so many people think that after the baby comes out, if you made it that far, you're good to go. You're smooth sailing. But so many things can still happen in that postpartum period. And we call that the fourth trimester, right? You know you're pregnant for 3 trimesters, but we call that the fourth trimester. And so many things can happen that you need to be aware of. And so that's what we want to really talk to you about today. So if you don't mind, I want to share a personal story that happened to me regarding this. And so, I told y'all I've been a nurse for 40 years, so I'm of a particular age. And I have my village, my sister girls. And so myself and another good friend, we were the only 2 in the group that weren't grandmas yet. You get a certain age, you ready for some grandbabies, okay? And so finally, and I mean finally, the both of us were gonna be grandmas, and we're so excited. And so both of our children ended up being pregnant around the same time. So my son and his wife, they were pregnant for the first time. And then my good girlfriend, my goddaughter, she was pregnant for the same time. So due within a couple of weeks of one another. We both had girls, yay, okay? So they're doing fine. It's been 6 months. But I want to share with you the story that happened with them. So my goddaughter, Nikki, she delivered first, okay? And as a good godmom that I am, she's not here in the same state as I am. I called to check on her. First day, she was just like, okay, everything is going okay. Her mom said, she's a little tired, had some breastfeeding questions, but everything was smooth sailing. So I just encouraged her, hey, sleep when that baby sleeps. You got all them people in the house that came to help you. Sleep when the baby sleeps and get your rest. So, okay, she's good. The next day, I call again, talking to her mom, tell me what's going on. How's everything going? How's Nikki doing? She tells me, sis, you know how she is. She has something to say about everything. Okay, but how's she doing is what I asked. How is she doing? She's complaining a little bit about her being tired. She just needs to get some rest. So I said, you know what? Let me talk to her because that's the nurse in me, right? I don't want to hear it secondhand from somebody else because either they're going to play it up or play it down. I want to actually hear from the patient how she's feeling. So I talked to Nikki. She calls me Auntie. Hey, babe, what's going on? Nothing, Auntie. I'm doing good. I'm just a little tired. I've been trying to get some rest, but I'm going to do it today. There was a lot of people here at the house yesterday, but I'm going to do it today. I said, okay, make sure you sleep, get your rest. She said, I had a little headache yesterday. It's a little worse today. So that's how I know I need to get some sleep. So I thought, okay, she got this headache. Let me delve a little bit deeper into this. So I asked her, I said, okay, you got a little bit of a headache. I said, do you have a blood pressure machine at the house where you can take your blood pressure? Oh, no, Auntie, I'm good. I don't have that. I know my body and it's just I need to get some sleep. Okay. Plus, I have not been drinking. I know I'm dehydrated. You know how much water I drink. I'm just a little dehydrated. I said, okay, Nikki. I said, I'm a little concerned. She said, Auntie, don't be. I'm telling you, I'm going to drink the water. I'm going to lay down. I just told Mom that I'm going to lay down and elevate my feet because I've been sitting up so much that now my legs, my ankles are swollen. So I said, okay, Nikki, I'm gonna need you to do something. I need you to call your provider and check in with them and let them know exactly what you told me. No, Auntie, it's good. No, babe, it's not good. You can have preeclampsia. Oh, no, I didn't have that during my pregnancy, she says. Okay, you can get it postpartum. You don't have to have it during your pregnancy. You can still get it postpartum. Call your doctor. I'm concerned. I'm going to call you back in 15 minutes. So I want you to call your doctor. Okay, she says. She hangs up the phone. I text my girl. Look, I just told Nikki to call the doctor. I'm calling you back in 15 minutes. My girlfriend calls me. She don't text me back. She calls me real quick, like, what you talking about? I'm concerned. I want her to get checked. I want her to talk to her provider and make sure that she doesn't need to follow up. You all need to start planning because she's probably going to have to go in to be seen. Somebody needs to take her and somebody's going to need to stay home with the baby. So get your plan together. And now 2 minutes has gone by, so I'm calling back in 13 minutes now. So y'all get ready for it. So long story short, she calls, the provider has her come in. She did end up having to be readmitted. She had postpartum preeclampsia. It can happen just in the postpartum period. She stayed in the hospital a couple of extra days now. They gave her medication to help bring down her blood pressure, get all that swelling off. She had to monitor her blood pressure once she got back home, take some medications for a short period of time, but she did okay. She did fine. And so my message to you all is several things. Number one, you know your body. You know your body better than anybody else. If it doesn't feel right, then you need to act on it. You need to say something, do something. Don't ignore symptoms, okay? You are your best advocate. Nobody can advocate better than you. You're used to advocating, I'm sure, for everybody else. You're going to advocate for that new baby. You're going to advocate for other children you have, your parents, your spouse, your significant other. What about you? Who's going to advocate for you? You're important. You need to advocate for you. What they say on the plane, put your mask on first before you put it on somebody else, that applies to you. They talking about you. So you need to do that. There are many complications that we're going to talk about tonight that can happen in the postpartum period that you need to be aware of. Everything just doesn't stop once the baby comes out, you clear, you good to go. No, there's things that you need to be aware of and be vigilant about. And then lastly, you may be surprised and you may not be surprised, but the stats out there are alarming. They are alarming of what is happening to women who are either pregnant or giving birth. We call that mortality and morbidity rates. It is alarming, and you all need to be aware of that so that if it's you or someone that you love, a close friend, that you can advocate for them. And so I'm going to turn it over now to my colleague and my sorority sister, Dr. Kamila Barnes, to tell you all about some of those stats.
Thank you so much, Shora Jackson, and thank you for sharing that personal story. And when they say nurses are angels, that is truly an example of that. And also just somebody else advocating for you, because sometimes you're in a situation you don't realize when you're in danger. We've all had that experience. So thank you so much for being persistent and making sure that you also follow through and followed up and you saved her life. I'm going to first just mention that I am the Assistant Regional Director for the Northeast Region for Chi Eta Phi Sorority Incorporated. And I'm very honored to be here speaking with my distinguished panelists today, my sorors and my colleagues as well, on this important topic. So now I'm going to share my screen and share with you the current state of maternal health. So just to go over a few terms that you may have come across, whether that's on media or, reading an article. So maternal mortality refers to deaths regarding pregnancy or postpartum up to 1 year. When you hear pregnancy-related death, that's death that occurs as a result of pregnancy. Pregnancy-associated death is death that occurs during pregnancy or postpartum but has no causal relationship. And so an example of that could be like a car accident during pregnancy or, domestic violence, homicide-related homicide during pregnancy would be pregnancy associated. Preventable deaths are deaths that were deemed that there was a chance or without reasonable doubt preventable. And we do know that currently where we are at is that 80% in some conditions, 100% have been deemed preventable deaths. And our key sources that we receive information from, and this is why it's so important to have continued surveillance and that we don't lose governmental jobs, the National Center for Health Statistics, and also the pregnancy mortality surveillance systems. So we really need to keep people in those jobs, in those positions, to continue our surveillance that help guide us. So these two charts look at the disparities that we have, heard about, and that is the racial ethnic disparity in the gap between when it comes to Black women in comparison to non-Hispanic white women, Hispanics, and also Asians. And from 2021 to 2022, the mortality rates did decline. However, there's still a 2 to 3 ratio in regards to maternal mortality when it comes to Black women compared to non-Hispanic white women. And also important to note that Black women who have a graduate degree and a high paid salary as well have worse outcomes than non-Hispanic white women who do not have a high school diploma. So we know that there are systematic issues, and this is about racism, this is about bias, this is about systematic barriers that cause these deaths. And when you look at the right, that is separating by age group, and you see that 40 and older have the highest mortality rates, and this is also has declined, but still very significantly high. And then also in this current generation, more women are having births 40 and over in comparison to prior years. So right now we are focused on Black maternal health in anticipation of the Awareness Week, but I also want to point out something very intriguing. You know, when you look at Asians here in the United States, even though they have been deemed to have the best outcomes, when you compare them to their native country, they actually have worse outcomes. So, you know, it's very important to understand that because, you know, it very much shows that we really truly have some systemic issues here. And this could be a whole presentation in itself, what those systemic issues are. But these graphs show a nice depiction and comparing, you know, the US to other industrialized nations, and also how comparison with Blacks in the United States, where maternal mortality rates to other countries. And as you can see, the very top line in the left chart, that is US Black women. And also, if you look at the lowest line, which is Norway, reported around 0 deaths. So we are so used to maternal mortality, and it needs to be understood that this is not normal, and that this can be something that's, like I said, 80%, in some conditions 100% preventable. And then the chart on the right also compares the breakdown of the racial ethnic groups in comparison to other countries as well. So we definitely need to do a lot better. The other issue that we have is that we have the lowest supply of midwives and OBGYNs in the US. We're all the way at the bottom here. There's a whole historical context as to why we do not have adequate amount of providers. And, you know, when it comes to midwifery practice, that is an ancient practice that goes back thousands of years in all countries. And so it is not a new practice, and it goes well beyond before it became an official profession. And also midwives were our birth providers, and historically our birth providers before hospitalization of births. Also providing doula support and comprehensive reproductive health care in our communities. And one of the many reasons why we do not have adequate midwives is because of the historical context of eradicating practicing midwives from the communities. And also the systemic racism when it comes to licensure and academic institutions, the Flexner report as well, that practically eliminated Black institutions. And so it's really important to understand the historical context of why we do not have enough providers. With, like I said, can be, you know, a presentation in itself, the history of maternal health. And also the extreme barriers in the system of attaining medical degrees, and the systemic racism when it comes to accomplishing professional licensures as well. And so all of that combined is causing these systemic issues. So we do not have enough birth providers to keep up with the demand of births in the United States, and also provide comprehensive reproductive health, which is so critical. The connection with repro and primary care services together help promote better outcomes, and also preconception care as well. So countries that are doing way better, if you look at Norway, remember I said Norway reported around 0 deaths. Look at the comparison. So we need approximately 5 to 6 times more midwives and birth providers overall in order to have better outcomes. And that is something that is also emphasized by the Commonwealth. So when does pregnancy-related mortality occur? So approximately a third of deaths have happened during pregnancy, a third happen at delivery or in the weeks after, and a third happen 1 week to 1 year postpartum. As you can see here, 52% of maternal deaths occur after birth in the postpartum period. So a lot of things in that period happen, right? You know, we also know that the majority of deaths are Medicaid recipients, and that's why Medicaid expansion is so important during that period of time. We also understand that, you know, the standard here is 4 to 6 weeks postpartum checkup, but in other countries that are doing better, they do postpartum follow-ups within a few days after birth. And that way also, if anything goes on, they're able to catch things early. So, so follow-up is critical, especially those who are high-risk pregnancy and high-risk deliveries. And also, the other aspects is just maternity care deserts. And in most states, about 30% to 50% of the counties have no reproductive health care, no obstetric care, and no maternity care services. And that number is getting worse with the reproductive restrictive laws in our country. And so this is really a crisis that we have, a deficit in our communities. We already do not have adequate enough amount of birth providers, adding on not even the facilities. And so even if we educate a woman about red flag signs and symptoms, if they can't get to a facility within the 10 to 15 minutes and they're driving over an hour, most time they pass away on the highway or at home. So so this postpartum period is also a very critical period as well. And so the other aspect of postpartum are what are the common postpartum complications? And so I'm going to turn it over to my soror and colleague, Jennifer Madkins, and I'm going to stop sharing. Thank you for listening.
Thank you, Sir Dr. Barnes, for sharing those powerful and valuable statistics regarding postpartum and just maternal morbidity and mortality. Definitely an eye-opener and definitely shows that there's more work that needs to be done to help address these health disparities as well as to improve maternal health in this country. So I have the pleasure of talking to you all tonight regarding some of the common postpartum complications that can occur. And I'm just going to share my screen. Okay. So, so I'm gonna discuss with you all
Jennifer,
yes.
we're seeing the presenter view, so you just need to swap it.
Oh, okay. Sorry about that. Excuse me. Let me exit. Let me just stop sharing this. I think I know what happened. Are you able to see my screen now?
Perfect.
Okay, thank you, Sorry, Jackson. Thank you for that. Okay, so I'm going to talk to you all about the common complications that can occur postpartum, their warning signs, as well as what actions should be taken. So the first topic that I wanted to, or first complication that I wanted to address was related to postpartum hemorrhage. Postpartum hemorrhage is one of the leading causes of maternal mortality worldwide. Bleeding after having a baby is something that is expected. It can be similar to a menstrual cycle. Usually the bleeding that occurs after delivery is starts off as a reddish color, and then within a few days it becomes a lighter color, like a more pinkish color, and then it transitions into like a clearish yellowish discharge. Okay. Postpartum hemorrhage, we can see in the hospital environment right after a patient gives birth. However, this can also occur after the patient is discharged home from the hospital, which we call late postpartum hemorrhage. And late postpartum hemorrhage can occur between 24 hours up to 12 weeks postpartum after delivery. Okay. And there are 4 causes, which we refer to as the 4 T's, which can contribute to postpartum hemorrhage. We have tone, trauma, tissue, and thrombin. So the tone refers to the tone of the uterus. Now, normally, the uterus is supposed to feel firm like a golf ball. That indicates that the uterus is nice and contracted. And when the uterus is contracting, that helps to control a mother's bleeding after delivery. Okay, so that's why, you know, if you had the experience or know of somebody, you know, when nurses are in the hospital, they press on a mom's abdomen to feel for that uterus to make sure that it's nice and contracting. Okay. The uterus should not feel soft or boggy like a softball. Okay. Because that indicates that the uterus is not contracting well, and that can actually lead to increased bleeding. And if it's not controlled, it can lead to postpartum hemorrhage. I'm going to start with tissue. So tissue refers to any tissue such as fragments of the placenta that remains inside the uterus after birth. And whenever there is anything in the uterus that's not supposed to be there, that can prevent the uterus from contracting. And that can also lead to increased bleeding. Trauma may relate to some type of, manipulation that may have been done during the time of delivery. For example, a mom may require the use of forceps or a vacuum to assist with the delivery of the baby. So one of the risks that can be associated with that is that it can increase the risk for postpartum hemorrhage, which is why that's something that we monitor very closely for after delivery. And then finally, thrombin relates to whether a mom has a clotting disorder that may also contribute to that risk of postpartum hemorrhage. Okay. So signs that we look out for, heavy bleeding, soaking a pad in an hour. So I have an illustration of a pad on your slide. So the one that we really get concerned about is the last one, where you can see that pad is saturated, which is not supposed to occur. Or heavy or gushing of blood that is coming from the vagina. If the mom is passing any large clots, any pain or swelling near her vaginal area or the perineum, which is the area between the vagina and the anus. If the mom feels dizzy, weak, or pale, if her skin feels clammy, or if she has a rapid heart rate. So these are signs that can indicate that the mom is experiencing a postpartum hemorrhage. And postpartum hemorrhage is a medical emergency. So it is important, if this occurs, to call 911 or go to the hospital immediately. The next complication I wanted to touch upon as well are infection. So infection can develop in various areas. So it can be a uterine infection, so an infection of the uterus, an infection of the incisional area if the mom had a cesarean section at that C-section incision, or if she had a vaginal delivery and had a laceration repair or an episiotomy repair from the delivery, breast infection, as well as a urinary tract infection. So, so going back to the uterine infection, we call that endometritis. The endometrium is the lining of the uterus, and that is what becomes infected. Okay. And so we get concerned if the mom is experiencing any tenderness in her uterus, like if we press on her abdomen and her uterus, her abdomen feels very tender to touch. If, if she has any fever, and I'll go over the additional signs and symptoms shortly. Wound infection, as I mentioned, is related to the cesarean section incision or a perineal incision. So if that becomes infected, urinary tract infection is due to bacteria that is found in the urinary system. And then finally, we have mastitis. So I have a picture of mastitis that is on your slide. So what you could see is mastitis is a breast tissue infection. Usually it occurs due to a plugged duct. We see that oftentimes when the mom is breastfeeding and her breasts are not emptied regularly, it could lead to mastitis to occur. And so signs of these infections would be a fever over 100.4, if the mom is experiencing chills, foul smelling vaginal discharge. That can be a sign of endometritis or a perineal infection. So if she's experiencing any foul smelling vaginal discharge, burning or pain when urinating can indicate a urinary tract infection. If the mom has a red or swollen incision, looking at the C-section incision, if it's red or swollen, that can indicate an infection as well. As I mentioned with the uterine tenderness, that's what we can see with endometritis. And for mastitis, the mom can experience one-sided and localized breast pain or redness at the site. Also, her breasts may feel warm to touch. And it's usually occurring on one side of the breast versus both breasts. So the action would be for the mom to contact her health care provider, because this would usually indicate that an antibiotic may need to be prescribed to treat the infection. So some infection prevention strategies is to perform hand hygiene. Hand hygiene is very important. Before and after perineal care, using the bathroom, prior to and after breastfeeding is important as well. For wound care, making sure that the incision remains clean, especially after taking a shower, to make sure, especially if it's a C-section incision, making sure that the incision is patted dry, so that doesn't increase the risk for infection. Also, if there's any abnormal drainage coming from the incision, to notify their provider. For making sure to wipe from front to back after using the bathroom, and breastfeeding management to help to prevent mastitis, to making sure that the baby is latched on properly and her breasts are being emptied of that breast milk. And that also will help avoid engorgement, which is engorgement means the breasts are overfull with milk, and that will help to prevent engorgement. Lastly, with nutritional management, drinking plenty of fluids, hydration is really important, especially after delivery, and especially if the mom is breastfeeding, eating foods high in vitamins, iron, and protein, and making sure to get adequate rest, which we understand sometimes that could be a challenge with a new baby, but I'm making sure to get adequate rest. Okay, so early intervention is critical to monitor for those signs of infection. The next topic I want to talk about is postpartum preeclampsia. And Sora Jackson shared her personal story with this. And as we heard from her story, postpartum preeclampsia can occur even if a person did not have elevated blood pressures during pregnancy. Okay, and so preeclampsia is a very complex condition that involves several body systems. And there are signs that the mom can present with that can indicate to us that she may be experiencing postpartum preeclampsia. Preeclampsia is usually known to occur, during pregnancy, but again, as we learn that postpartum preeclampsia can occur after delivery, even in a person that does not have any blood pressure issues. Okay, it can occur up to 6 weeks postpartum. All right, so signs that can indicate to us that that postpartum preeclampsia is occurring is a blood pressure reading that is 140 over 90 millimeters of mercury or greater. That's why, having a blood pressure cuff is really important, especially if it's associated with these other warning signs. So a severe headache, changes in vision. So some mom may see like their eyesight is blurry, or they may see spots before their eyes. Those are not good signs. Upper abdominal pain, especially if it occurs on the right-hand side. Some moms may report it as feeling like they have indigestion, but it can actually be a sign of preeclampsia. Nausea, increased swelling in their hands and their feet, shortness of breath, sudden weight gain. So these are important signs to, if you know of somebody who just had a baby and is experiencing these signs, or you yourself just had a baby and experiencing these signs, to notify your provider right away. Go to the emergency room, because the main concern that we have is that untreated preeclampsia can lead to seizures or a stroke. And so that is one of the complications that can lead to maternal morbidity and mortality. So that's why it's important to, once we identify it, to seek help right away. The treatment would be with antihypertensives, and there is a medication called magnesium sulfate that would be administered in the hospital to prevent seizures. Okay, and so monitoring would be in the hospital, looking at those laboratory values, monitoring the symptoms that the mom presents with, as well as monitoring blood pressures. And lastly, I just want to talk about deep vein thrombosis. We also refer to that as a DVT for short. Deep vein thrombosis is a blood clot. A blood clot can form in the leg. And the concern that we have is that with a blood clot, it can travel to the lungs and it can travel to the heart, okay? Which is a life-threatening situation if that occurs. So I just want to explain with pregnancy, pregnancy is a state where clotting factors are increased. And that is believed to be due to offsetting that bleeding that occurs during delivery. So that helps the blood to clot to compensate for the increased blood loss that occurs during delivery. However, this state, we call it a hypercoagulable state, still remains even after delivery. And so that still increases the mom's risk for developing a blood clot. Okay, and so some of the risk factors related to deep vein thrombosis is if a mom had a cesarean delivery or has been on bed rest for a long time, that can prevent the flow of blood, circulating back to her heart. And that's why we encourage, moms to, get up and walk to help to decrease that risk. Diabetes, obesity, as well as advanced maternal age are risk factors. Other risk factors include preeclampsia, postpartum hemorrhage, or if the mom had a history of blood clots. I don't know if you recall, several years back, Serena Williams shared her story with her history of blood clots, and that put her at an increased risk for DVT. So what are the warning signs that we look for? Leg pain or tenderness, and that usually is occurring in one leg. So you could see the image on your screen where you see a normal size leg and you see a leg that is more swollen, bigger than the opposite. That unilateral swelling, okay, in that affected leg. Warm and red in the affected area. So usually we notice this redness and warmth in a woman's calf, in her calf area. Okay. So if she's experiencing pain, redness, warmth, swelling, these are signs that could indicate a deep vein thrombosis. So if this is suspected, again, notify your provider. Seek medical attention immediately because it may be necessary to be started on blood thinners. Okay. So management would be early ambulation, so walking right after delivery to get that mobility going, that flow of blood going, elevate the legs. Compression stockings may be ordered by the provider, or an anticoagulant, such as, which is a blood thinner, may be necessary. Okay, so again, the concern is that it can lead to a pulmonary embolism if that clot does travel up to the lungs. So these are the complications that I wanted to talk to you about this evening. So as you can see, postpartum complications can escalate quickly. So early recognition and action can save lives. And I am going to turn it over to my soror, Jazmine White-Johnson, who is going to be sharing additional complication as well as reiterate those post-birth warning signs to be aware of. So I'm going to stop sharing.
Thank you, Sora Madkins. Good evening, everyone. Again, my name is Jazmine White-Johnson. I'm going to share my screen. Let's do. Bear with me. I'm having a slight snafu here.
If it helps, Jazmine, we can see it. It's just not in presentation mode.
Got it. Okay. So here. Be kind to me now.
We
There we
are in a safe space.
Thank you.
We are among friends.
Okay.
And the comments are
So we're going to talk a bit about postpartum depression and those post-birth warning signs. Earlier this evening, you heard us talking about postpartum being referred to as the fourth trimester. Again, just to refresh your memory, that's the first 3 months or 12 weeks after birth, and it's primarily focused on your physical recovery, bonding and attachment, emotional adjustment, learning or refining your parenting skills if this is your second or third baby, and figuring out what your new normal looks like. For the feedback that we get from our first-time parents is they don't have a clue what they're doing. And this is completely out of what normal looked like for them. Having a child and becoming a parent changes what your normal does look like. During that time, you will hear friends, family, loved ones say, oh, you just have the baby blues versus, are we considering postpartum depression? So let's figure out what the difference between those two things is. The baby blues are described as the dip in mood after giving birth. It is caused by the drop in hormones after delivery and is considered a normal response to birth. It's normal for you to be hyper emotional in that immediate postpartum period. You just put your body through one of the most traumatic things it can experience and brought life into the world. It took 9 months for your body to gear up all these different organs and increasing blood volume and increasing hormones to help create this little tiny human. And now that tiny human is outside of the body. So you have to return to baseline. So that surge of hormones will ultimately drop. It can begin as early as a few days old after delivery, but it typically should improve by the second week postpartum. Largely to do is that you are back in your home space, you've established a routine, you have your support people or your village, and you've had a chance to kind of reset, not only mentally, but physically. Labor is exhausting, so there is always sleep to be caught up on, and your body is now changing in a way to accommodate you to nurture or nurse your child. So you're creating milk, you are trying to control your own bleeding. Your body has a very fascinating way of doing that by keeping your uterus contracted. So all these things are happening in the background. So it's very normal for you to feel overwhelmed, extremely sensitive, even weepy. We worry past that second week that it could be possibly postpartum depression, and that's highlighted by worsening or severe mood symptoms. That can continue past the 2 weeks postpartum, and it does affect about 10% of women. There are pre-existing conditions that can put you at higher risk. It can be having a complicated delivery. A lot of our moms with a birth plan, when things don't happen according to plan, they almost grieve that experience because it did not happen the way that they had preconceived in their own minds, and that puts them at higher risk for postpartum depression. Parents who've experienced a loss, you can still have postpartum depression after that. Parents of multiples, parents of babies who are in the neonatal intensive care or premature, IVF parents especially, are at higher risk for postpartum depression, especially if this is your first, second, third, fourth, fifth cycle of attempting to have a child, and also advanced maternal age, that meaning anybody over the age of 35. Are multiple treatment options for postpartum depression. It does depend on the severity. The first step in any treatment plan, of course, is awareness. Not only do you have to be aware that that's where you are mentally and emotionally, but your village and your family has to be aware that that's where you are so that they can identify your need for help. Therapy and treatments include speech therapy and in some cases medication. So here's a picture of everything I just talked about, and you'll notice how the baby blues seem to be fairly mild compared to full-blown postpartum depression. One of the big hallmarks of postpartum depression is an overpowering feeling of guilt, panic or sadness, anxiety, fear of being alone with your infant, or scary thoughts about yourself or your baby. One thing we stress in your discharge planning and care is that if you have any harmful thoughts towards yourself or towards your baby, please make your way to a nearby hospital or medical facility. That is something we take extremely seriously. And there is no shame in making it aware that you do need some help. We as healthcare workers and healthcare professionals are here to support you in this very complex period of your life. If you feel as though you cannot safely travel, please don't hesitate to call 911 to get the resources to you that you need. One of the other things that we talked about as far as postpartum complications are those post-birth warning signs, excuse me. This is a flyer actually that was brought on by AWON, which is one of the governing bodies of obstetrical care in the country, and actually globally, as a guideline on who to call, when to call, and why you should call. You may have seen this in some paperwork already. You may see this in the flyers in your doctor's offices or your birthing centers. But the acronym post-birth is designed to help you identify when to call for help, and it helps your family and those caring for you and your baby as well. The most important part of this is to trust your own instincts. You know your body. You are your biggest advocate. We can't tell directly what's happening with you internally. So you should never be afraid to actually speak up and advocate for yourself. So the P, pain in your chest. It can be sharp, it can be dull, it can be aching, it can be pressure. Obstructed breathing or shortness of breath typically will be early onset or immediate onset. Seizure activity, of course, would not be readily noticed by you because you're in the throes of it, but your partner, your loved ones would know to call 911 immediately for any seizure activity. And those harmful thoughts of hurting yourself or someone else. Those first four are all immediate signs to call 911. Don't wait, don't hesitate, don't even second guess it. If you feel that you are in a dangerous space mentally, 911 responders will actually just recommend that you dial and then drop the phone so that they can at least get someone to you. The second half, excuse me, of the post-birth warning signs are when to call your provider. And you only need to have one of these signs. You don't need them all. So the B is for bleeding, soaking through your pad in its entirety, an hour, or blood clots the size of an egg or bigger. We talked about that previously. Your bleeding in the postpartum period is supposed to be getting progressively lighter in both amount and in color. If at some point it reverts back to a dark red or becomes heavy again, notify your healthcare provider. The I is for incisions that are not healing. That could be your C-section incision, or it could be your perineal repair if you had a tear or needed an episiotomy. If there is something abnormal, drainage, redness, swelling, call your provider immediately. Red or swollen leg, we just talked about the deep vein thrombosis. That is painful or warm to the touch. That's another reason to call your provider. Any temperature over 100.4 or higher, or 96.8 or lower. One can mean fever and infection. The other one can also mean sepsis. Headache that does not get better, even after taking medicine, or a bad headache with vision changes. Excuse me. We worry about that preeclampsia in the postpartum period, and we spoke about that again briefly. A headache that cannot be relieved is concerning. When you call 911 or you call your doctor or you arrive at the emergency room as a walk-in, it is gravely important that you specify to whoever is doing your intake that you have just given birth, because that helps us as the healthcare team better treat you in a timelier manner. So when you are arriving with 911, on the phone with 911 or your healthcare provider, the first words out of your mouth should be, I gave birth on this date and I am having this symptom. That helps us fine-tune what we need to do for you so that we can intervene as rapidly as possible for better outcomes. The QR code that's on your screen now has this post-birth warning sign in multiple languages. So if English is not your first language, or you know someone needs a second language, I believe this flyer is now in 15 to 17 different languages now, which is amazing. Excuse me. So that was a lot to say as far as postpartum depression and post-birth warning signs. Most facilities, birthing centers, doctors' offices, hospitals alike are going to do a screening for you about postpartum depression. It may be called the postpartum depression screening or the Edinburgh tool. And it's just to see how your mental health is within that last week of your pregnancy leading into delivery. And most providers are going to repeat that test afterwards. It is not punitive. It is not a contest. It is just to see if we need to provide you with any more resources than we already have. There is no shame in it. There is no right or wrong answer. It is just where you are in that moment. And if you need to support, we have that for you. So who can bring you that kind of support? Who can you tell? Who can you reach out to? Everyone, your doctors, your midwives, your lactation consultants, even your pediatrician, and point you in the direction of resources for postpartum depression and post-birth warning signs. Your local hospitals and health centers will have signage available and often will have phone numbers for local resources available. There's also the National Maternal Mental Health Hotline, which is 1-833-TLC-MAMA. There's also the Postpartum Support International, which is 1-800-944-4773. And of course, the Suicide and Crisis Lifeline. And for that one, you can call or text 988 to be connected to a resource wherever you are. And all of those resources with phone numbers are available 24 hours a day, 7 days a week. So if you feel as though you need any type of support, please reach out. There are also your local community centers. There are Facebook groups and social media groups now that are extremely beneficial. There are moms groups that are posted at libraries, churches, kids' gyms. There are a multitude of ways to connect and to help fortify your village, to help make your postpartum period and your journey through motherhood as healthy and as positive as possible. And that is all I have for you this evening. Thank you very much. And I'm going to stop sharing my screen.
Thank you so much. I don't know if you guys can see the hearts and the claps and the and the love. Before we move any further, Jazmine, we need that last slide for sure. But we also would love to have all of your decks. There was such rich information, and I would suggest as a grandma and not as a clinician, for those of you who are expecting, you know, we can pull some of the slides and say, okay, definitely that one, print it out, tuck it somewhere. My daughter says nobody puts things on the refrigerator anymore. But maybe not put it on the refrigerator, but put it on a bulletin board or put it somewhere that your family can find it or where you can easily access it. And then we did drop, just for everyone's reference, the, oh Lord, help me, the A1, Dufunkel, that you can see the warning signs. And that's another one I would encourage that you have. So I know we're a little bit over, but I want to, if you guys have a few minutes, I'd love to allow our audience to ask questions. I've been culling a couple of them. But we just, this is so critically important as Judi started the conversation. We so often assume if anyone's like me, you watch Call the Midwife, and they only have their trauma before birth. And then after the birth, there's that happy ending, and then we go on our way. And I think that's created the perception that the fear or the risks are, they don't continue after the baby is born. But as these brilliant ladies have shared with us today, the statistics show otherwise. So we want to make sure that everyone has a chance to ask questions. One of the things that I'd love for us to talk about, and what do I do if my doctor doesn't respond? I've seen this brilliant presentation. I know something doesn't feel right, Judi. My girlfriend Judi, my mama's girlfriend, tells me that I should call my doctor, and he says, you just gave birth, and of course you're going to feel tired. So what do I do then? Anybody? Somebody?
I'm sorry, I was looking for the mute button. So, what I recommend, of course, is always, like you said, start with your provider, of course. I have a whole different kind of perception about that if your provider doesn't take you serious, right? But at that point, you're trying to advocate for yourself, which we're encouraging you to do. And so there are other avenues, you can always seek. There's triage nurses that you can call. They can guide you to maybe another facility to go seek care. But I wouldn't, if you feel in your gut that something isn't right, like I said earlier, you are your best advocate, then don't take no for an answer. I mean, the bottom line is, as a last resort, yes, you could go to an emergency room, but there's other things that you can do before that. So typically all provider offices have some type of triage nursing system where that's a first place where you can start if the doctor has said, or the provider has said no.
Thank you, Judi. Jazmine, there's a question for you. All these J names, Jennifer, Judi, Jazmine. But Jazmine, you had mentioned a specific screening for postpartum depression that wasn't the EDS or PHQ-9. Can you repeat that screening name again?
So we use a bunch of different tools to screen for postpartum depression. Sometimes it's just called the postpartum depression screening tool, or it's referred to as the Edinburgh tool as well.
Thank you. And then here's a question for anyone. How does the practitioner identify blood clots in Black women with darker skin? If our skin doesn't turn red, what color changes would we be looking for to detect a clot? Or should we just look for other signs that you shared?
I could take that question. So for women with darker skin, so the area where the blood clot is located can actually appear a little bit darker than the person's skin complexion. And then also too, when you touch that area, it's gonna feel tender to touch, or it, feel painful to touch as well. And then, along with that warmth, and the area will appear swollen as well.
Thank you. And someone has their hand raised, and let me make sure how I can unmute them. Bear with me a sec. I'm trying to find you, Dr. Julia. There we go. I'm trying to unmute you, so now you can unmute yourself. Or was that a inadvertent hand raise? Barbara Julia? While she's doing that, let me ask one of the other questions. Mental health resources. Sometimes there is a stigma in our community about mental health. Dr. Jazmine, how do we, Dr. Jazmine, I'm sorry, I'm still thinking about Dr. Julian and whether she really wanted to talk or not. But Jazmine, how do we, if I'm mom and I feel something, and I try to tell my mom, or I try to tell my husband and they dismiss it. Can you give us some language that that would help us have this conversation?
Okay, not a problem. And as far as the doctor, maybe we're speaking that into existence. Who knows? As far as language, there is a stigma around mental health in the African American community in particular that we don't go to counseling. We don't go to therapy. We pray about it. We don't talk about it. We shove it down. You just need sleep. You just need food. You just need to pray. We've seen firsthand how damaging that type of behavior can be, especially with how we treat our neurodivergent population now. But in terms of our mental health, postpartum, the person going through that journey is you. So you have to push past the placating verbiage of your family. Oh, you're fine. You just need sleep. No, this is something that is not normal. I do not feel like myself. I am concerned. I just want to be ensured that this is being cared for correctly. Sometimes you have to say, I love you, but go away. I'm going to go seek therapy. It will make you probably the talk of the potluck or the talk of the backyard barbecue. But are you getting the resource that you need? Yes. Are you feeling safe in your postpartum journey and your transition into motherhood? Yes. Those of us that know. There is no shame in getting the resources that you so desperately need. Oftentimes, the person that is the key to getting your resources and to being heard is someone that's not family. Sometimes it is a family friend or a neighbor or even the postman. Hey, I noticed that you're looking kind of, different. You usually have a welcoming smile when you open the door to come get your packages. I haven't seen you. Are you okay? Sometimes that's the change we need. That's the catalyst we need to go seek help. There is no shame in it. And I encourage it. Please, if you feel out of sorts, go ask for some help. I would rather a provider tell me that this part is expected. Because us as providers, we tell you until we're blue in the face what you should be looking for, what to expect, what to call us for, what to go to the hospital for, because we want your best outcome.
Thank you. Thank you for that. And you're right, Dr. J. Dr. J said many times it's the family that recognizes that something isn't right. But then sometimes I would submit as a lay person that we may recognize that something isn't right, but we don't know what we don't know. So these conversations are so critical. Thank you all so much for joining us tonight. I can't tell you how incredibly grateful we are. We will have a recording for our audience. We'll send you guys the link. You'll be able to replay this, share it with your families. It's so important. I would not to bring politics into it, but to bring politics into it now more than ever. We need this community. We need to know how to advocate for our families and to recognize when we may have to. One of the other, I told her I was going to steal this phrase. One of our panelists with one of our other workshops said, we need to know when to flip the table. And as a minister's daughter, I could immediately see that context. And so there may be times where y'all gonna have to flip the table for those you love. But at the end of the day, I'd rather be a little less eloquent and flip a table than have my something happen to my family, right? So thank you all for the learning so that we know when to flip a table, when to tell our daughter to go seek help. Thank you to our audience and join us tomorrow night. Our first workshop is at 5. If you haven't registered, sorry, we're at capacity. So we broke the internet just like VP Harris. But no, we are at capacity, but we will have a recording. We've got an amazing panelist. For those of you that registered, if you're not coming, take it off so we can let our wait list in. But thank you all. Have a great evening. And we hope to do another program with you soon. Thank you, Dr. See, I'm trying to look at all these Dr. Deborah Stamps for joining us and your leadership with this wonderful organization.
Well, thank you, Marie. It's been a pleasure. Thank you to our panelists. You all did an amazing job. I love the expertise that was here, from the personal story to the data and stats to the complications, the postpartum depression, and a list of resources. So everyone can walk away with a personal connection. We appreciate Chi Eta Phi Sorority Incorporated, and really thank you to Dr. Janet Williams for bringing us together with Safer Birth Collaborative for this opportunity to partner with you as we kick off Maternal Health Week
Yes.
next week. And so again, thank you all so much. Kudos to all of you. I can't wait for the recording so we can share that. And just great information. I learned a lot tonight. Thank you.
Thank
And
you.
our national president wasn't able to be with us tonight, but she does also bring greetings as well, Dr. Sarah Killian.
No, we'll let Dr. Killian know. We'll give her a second chance. We'll have a part 2.
Awesome. Thank you so much, everyone. Great
Ladies, have a
job.
good night. Bye-bye.
Thank you. Bye-bye. Bye.